Can the pharmacist refuse to fill a medication? The answer is yes. Next question. Just kidding. So yes, a pharmacist can absolutely, it is in their code of ethics, it's in their kind of code of professional standards that they absolutely have the right to decline filling any prescription that they feel is an error, could put the patient in danger, or that kind of violates their kind of socio-personal beliefs. Most times, as a psychiatrist, we don't deal with a lot of medications that come with all of the kind of political stuff. So we're not writing medications for like oral contraceptives, because that's one big one. We don't write for very many medications that kind of trigger lots of warnings and things. But the pharmacist, because pharmacists are amazing chemists, they know everything about chemistry. They had to take a lot of chemistry classes, and so they are really well trained to know interactions between medicines. They are really well trained to keep in mind all the other things that people assume and consume. So like supplements, things like that. And so if a pharmacist gets a prescription and they read over it and they're like, oh, I don't think this makes sense, then they absolutely have the right to say, nope, I'm not going to fill it. Now, here's a good part. Most pharmacists won't do that. They will actually tell you and give you a reason why they're not going to fill it. In the psychiatric world, most times is going to be for safety. So in other words, if they see multiple prescriptions come in for medicines in the same category, they're probably going to flag it. For example, if you were taking Lexapro and Prozac and Zoloft, when that last prescription comes in, the pharmacist is probably going to go, I don't know about this one, because you're on 3 different medicines that work on the same system, and that really can put you at risk for certain side effects and certain disorders. And so the other thing that I saw this week was a pharmacist said, wait a minute, the numbers of these stimulant medications don't make sense. And it was very specific to that particular case. And the case in point was, we're trying to figure out where the right dose is for that particular child. And so when I wrote the first medication, I think I underdosed the kiddo, because we were able to bring their dose up to a point where it was effective. Hooray, right? Well, the problem is I only dispensed so many tablets with that original prescription. And so when I sent in the second prescription for more tablets, it looks like the family is using them faster than they're supposed to. And there's a rule that states that, again, the pharmacist can decline filling a prescription if they feel that there's an issue. And so if the pharmacist thinks, what is this family doing with all this medicine? Because according to the original label, they should have a lot of medicine left, then they can put the kibosh. They can stop that whole process. Fortunately, we have really great pharmacists where we live. It feels like I know or am connected to most of them in a good way, of course, not like in a bad way. So in a good way. And so we were able to call and get everything straightened out. But I did want to make a point of saying, yes, we love our pharmacists. Pharmacists keep us safe. That was going to be my alternative plan if I didn't get into medical school, was to actually become a pharmacist. And so I took my PCAT, which is the Pharmacy College Admission Test. And I worked for a couple years at Eckerd Drugs as a pharmacy tech. So I knew most of the medicines and the lingo and how things work. So I'm a big fan of pharmacists, and I love what they do. And yes, we want to make sure that we are respectful and thankful to all of our pharmacists, especially since now they are asked to do so many things like gift shots and stuff. That was not a thing when I worked in the pharmacy. So yes, so thank you to all of our pharmacists for all the work that you do.